Welcome to your weekly checkup where we bring real hope and real answers to people dealing with real challenges. I'm Dr. Jonathan Lazar, and today we're diving into a powerful and misunderstood condition, Tourette syndrome or TS. Now, this is not just a textbook condition for me. I've had the real honor of working with patients, especially kids, who were once crippled with their tics, vocal outbursts, obsessive thoughts, and I've watched them transform. Jaden is off today, but wishes her best. We're going to cover a lot today. We're going to cover what Tourette's really is, what's going wrong neurologically in these situations, what the research actually says, and most importantly, what's working, what's helping real people get their lives back. Now, whether you're a parent, teacher, friend, or if you're living with TS yourself, I want you to know this: there is definitely hope. So let's begin with the basics. What is Tourette syndrome? Well, it's a neurological condition involving involuntary motor and vocal tics. But the definition barely scratches the surface. What most people don't realize is that Tourette's is a brainstem issue, a misfiring in the communication network between the brain and body. Now, most kids start showing symptoms around age 5 to 7. The tics can be as simple as blinking or sniffing, or more complex like jumping or repeating words. And let me pause here and say something important. TS is not a behavioral disorder. Tourette's are not bad kids. Or kids with Tourette's are not bad kids. They're not undisciplined. They're not seeking attention. Their nervous system is misfiring, period. I think it's really, really important that we point that out, because so many times people think this is about behavior modification, or that parents should simply be better parents or discipline their kids more or have stronger consequences. And that is just, it's sad to hear that, because they are dealing with a neurological challenge. And just like any other condition, if you have a splinter in your toe, you might walk funny, and it's not necessarily for attention. It's not for attention at all. It's that there's something not right. So I think it's very, very important we point that out. If you're just tuning in, you're listening to your weekly checkup. I'm Dr. Lazar. We're going to take a short break, and we'll be back right after this. Welcome back to your weekly checkup. I'm Dr. Lazar. If you're just tuning in, we're talking about Tourette syndrome and how it's actually a brainstem issue. If you have questions about Tourette's or anything else health related involving the nervous system, our number is 866-521-WELL, 866-521-9355, and we'll be taking your calls throughout the show. So speaking of Tourette syndrome, let's talk science, because this really matters. Tourette's is linked to dysfunction in what's called the basal ganglia, that's part of the brain, also in the thalamus and in the brain stem. Those areas are involved in motor control and inhibition. But this is where it gets really interesting. A 2010 study in the Journal of Child Neurology revealed that abnormalities in the cortico-stratio-thalamo-cortical circuits, that's a lot, but in the brain, in the circuits going back and forth between different parts of the brain, could be linked to abnormal sensory motor gating. What does that mean? Well, it means the brain can't filter out irrelevant stimuli. So think about this, kids that have sensory challenges. The brain receives 11 trillion signals every day. Imagine those signals aren't filtered. Then it's a complete overload. That's exactly what happens with sensory kiddos, for example. But if the brain can't filter out irrelevant stimuli, that can trigger both motor and vocal tics, because it's the body creating its own stimulus, because there's a sense of control there. And guess what directly influences that system? It's the upper cervical spine, specifically the atlas and axis C1 and C2 up at the level of the brainstem between your ears. When that area is misaligned, the bones can distort brainstem input, and that's what causes overstimulation of the central nervous system. So sometimes it shows up as sensory issues, sometimes it shows up as focus, concentration, memory challenges, sometimes it shows up as something like this, like Tourette's. Let me paint a picture for you. Imagine trying to run high-level software with scrambled input signals. That's what kids with Tourette's deal with every day. And often we see that correcting the structure or restoring the integrity of that input in the upper neck dramatically reduces the symptoms. Now, we're not about chasing symptoms. We're not about altering how the body functions or expresses artificially. We're about your body or your child's body functioning the way God designed it to function. Highly adaptable, highly resilient, highly impactful. That's what this is all about. If you're just tuning in, this is your weekly checkup. I'm Dr. Lazar. Jaden is off tonight, but wishes her best. Our number is 866-521-WELL, 866-521-9355. We're going to take a short break, and we'll be back to answer your questions right after this. Welcome back to your weekly checkup. I'm Dr. Lazar, taking your calls at 866-521-WELL, 866-521-9355. If you don't have a question on the air but want to see if this care can help you or someone you love, you can call that number as well. We have local programs. We have intensive programs for people to come in from wherever. So if you know somebody suffering with this, please share this with them. Also, for those of you listening on social, if you would please like and subscribe. This will allow this message to get in front of more people. So thank you in advance for that. So we're talking about Tourette syndrome. And the issue we see is with upper cervical misalignments leading to brainstem dysfunction. By upper cervical, I mean upper neck. And if you put your fingers right below your ears and you were pointing inward, you'd be pointing at your brainstem. Now it's like behind your eyes and nose and in the center of your skull, but so you can't touch it, but that's where it is. So now that we've talked about the deeper neuroanatomy involved in Tourette syndrome, I want to zero in on something that's often ignored or dismissed by mainstream medicine, but maybe one of the most important root causes. Let's talk about the upper cervical or upper neck misalignment. I'm talking about the top two bones of your spine, C1 atlas and C2 axis. These aren't just bones, they're actually gatekeepers to the brainstem. C1 specifically surrounds the brainstem and is designed to protect it. Now, think about this. Your brainstem controls things like muscle tone, eye movement, facial expression, voice, swallowing, even emotional regulation. So what happens when there's torque or tension in that area? Well, quite simply, the signals between the brain and body become distorted. They don't shut down completely, they just get really, really noisy. I heard an interview with Kevin O'Leary, Mr. Wonderful, and he talked about his time working with Steve Jobs and how Steve Jobs was a master at differentiating between signal and noise. Signal and noise. Listening to this radio show, if you're listening to it over the radio, there's a signal coming to you. And if you're tuned into the right channel, that signal's getting to you very clearly. But what happens if you're off by just a fraction of a megahertz on the channel, on the station? If that happens, then there's going to be a lot of noise on the line, and you're not going to be able to hear clearly or crisply or with certainty. You're not going to be able to hear those because there's too much noise. Well, the same is very, very true with the brainstem and nervous system. When the signals between the brain and body get distorted, it creates a lot of noise. neurologically. Now the signals aren't getting into the brain or out from the brain in a clear way or in an effective way. And that noise, that is what tics often are. It's fascinating. The good news is most of the time it's very fixable. Now we know ahead of time whether it's fixable or not. Not ahead of time in terms of guessing, but ahead of time in terms of our assessment. So we utilize what you've heard of called the Lazar method, and it's a proprietary system where we're able to look at the nervous system, at functional movements in the spine, and how that affects the overall nervous system function, specifically at the brainstem. That's really, really important for all bodily functions, especially something like Tourette's. A 2013 study in Frontiers in Neurology talked about, quote, the sensory motor integration failure in patients with Tourette's. Now, when I read that, my first thought is that's exactly what we see when the upper cervical spine is misaligned. Again, sensory motor. So sensory is signal coming to the brain that your body responds to or feels. Motor, the movement of things. Integration, so sensory motor integration, failure. You'll see how this plays out. We take precise x-rays of your spine, of a child's spine, someone with Tourette's or chronic tics. We often see rotational misalignment. We see ligamentous tension. We see changes in the alignment of the dural tube that houses the spinal cord. And I'll say this gently but clearly, you will not drug your way out of that structural problem. You will not drug your way out of that structural problem. That's why so many parents come to us from all over the world after trying everything else. And here's what really matters. The adjustment is not forceful. We're not twisting. We're not cracking anything. Our QSM3 technique that we use in the Lazar method is precise. It's gentle. It's extremely powerful. When you correct the structure, you change the function. And when you change the function, you change lives. That's what we're about. 866-521-WELL, 866-521-9355. I'm Dr. Lazar. I'll be back answering your questions right after this. Welcome back to your weekly checkup. I'm Dr. Lazar. Our number is 866-521-WELL, 866-521-9355. And you can call us anytime, day or night throughout the week. Now, we're not always staffed, but we do get the messages. Now, this episode is an important one to me because since establishing the Lazar method over the last 17 years, what we've noticed in terms of results, because we specialize in restoring function for the world's toughest neurological cases, we find that when people are ready for a real solution, they stop at nothing to get that addressed. And if that's you, if you're ready for a real solution, visit lazarspinalcare.com or call to schedule your consultation today. We can do that virtually. Again, we have intensive programs for our out-of-town guests, and we would love to see if you qualify for that. Now, let me take you into the room with me for a moment. We had a teenage boy come into our office. He had tried 6 different medications. You can't count it on one hand. He tried 6. He'd been expelled from school twice. His parents were on the brink of divorce because the stress was that intense. Every night was chaos. Every social event was painful. His tics were physical, verbal. They were emotionally overwhelming for everybody. He came in with a hoodie over his head. He wouldn't make any eye contact. We did our full neurological assessment, including balance testing, posture analysis, thermographic nerve scans, 3D imaging of the upper neck. And what we saw blew his neurologist away. He had severe left atlas rotation compressing his right brainstem. Now, his nerve showed massive autonomic overload. That wasn't behavioral, that was biological. So we began upper cervical corrections, nothing invasive, nothing painful. Within 2 weeks, his words, not mine, his words were, quote, "It felt quieter inside my head," end quote. 2 weeks after 8 years of suffering. Now, listen, this didn't cure his Tourette's. We're not claiming miracles, although I think they are sometimes, but we don't get to take credit for those. But this did give him a foundation to rebuild his life, and that's the part that's key. Here's what's beautiful. His parents had hope. They started smiling again. They started having dinner together again. His grades improved. His confidence came back. That's why we do this. Dr. B.J. Palmer said, "You never know how far-reaching something you may think, say, or do today will affect the lives of millions tomorrow." We didn't know, by taking care of Aiden, that that was going to have such a profound impact on his parents' marriage. Now, that was several years ago. They're still together. And we don't treat Tourette's and we don't treat marriage disruptions. We don't treat pre-divorce scuttles. We find the interference in the nervous system, your body's control system, and we remove that interference, and life starts to look very, very different. 866-521-WELL, 866-521-9355. I've got another story for you about a young lady. I'm going to share that right after this break. Don't go anywhere. Welcome back to your weekly checkup. I'm Dr. Lazar. Our number is 866-521-WELL, 866-521-9355. We talked about a young man who he had a severe left atlas or C1 rotation. It was compressing his right brainstem, and his nerve scans showed massive autonomic overload. So his problem wasn't behavioral, it was biological. And as stated, when we began the upper cervical corrections, there was nothing invasive, nothing painful. Within 2 weeks, his words were, "It felt quieter inside my head." He had been suffering for 8 years. This was 2 weeks after he started. This gave him his foundation to rebuild his life. I mentioned his parents started smiling again. They started having dinner again. His grades improved. His confidence came back. Guys, this is why we do this. Now, let me share one more. A young woman, age 22, she came into us with Tourette syndrome that had become debilitating after a car accident. Now, pay attention to that, because a lot of times people think it just happened, or they don't realize that there was a preceding incident that happened. She had a car accident. Her neck pain, migraines, facial tics made it impossible for her to work. She tried Botox injections. She tried psychiatric medication, acupuncture, you name it. No one had ever checked her upper cervical spine, her upper neck, where this bowling ball called our head sits on this little tiny 2.5-ounce bone. With precise imaging, a customized plan, and 6 months of care, including upper cervical adjustments, our soft wave TRT stem cell work, and custom supplementation, she returned to work full time. Now, 6 months isn't overnight, but it takes the body time to heal and regenerate, and that's exactly what happened. She wrote me a letter I'll never forget. She said, "Dr. Lazar, you gave me back my identity, not just my function, my identity." These aren't just case studies. These are sons, daughters, coworkers, friends. If you're listening to me and you're thinking, could this help me? Could this help my child? Here's the answer. Let's find out. Our number is 866-521-WELL, 866-521-9355. I'm Dr. Lazar. Jaden is off this evening, but wishes her best. We're talking about Tourette syndrome and talking about if this upper cervical care, the Lazar method, can help. We're going to take a short break. We'll be back right after this. Welcome back. I'm Dr. Lazar. This is your weekly checkup. 866-521-WELL, 866-521-9355. If you're listening and you are interested, we'd love to offer you a complimentary consultation. If you're local, we can do that in the office. If you're remote and you're hearing this online or somebody shared it with you, thank them for sure. And I'd like to thank you for sharing with others. The way I see it, if somebody had told you about this sooner, you could have potentially gotten help sooner. So don't wait. Share this, like it, subscribe so other people can have access to the hope and the possibility here. If you're virtual or remote, we're happy to do a virtual consultation that's normally $224. We will waive that fee for any WMUZ listener. And so we're happy to chat with you regarding that. And if you're local, we've got corrective programs, we've got care plans that will help. If you're not local, we have intensives that can be 1 to 2 weeks where we can really do some life-changing work. Now, speaking of Tourette's, let's go a layer deeper on this. When the nervous system is inflamed or it's injured, it needs support beyond alignment. Now, alignment is the most important for sure because you can't out-medicate a structural problem. And when there's a misalignment, that's structurally interfering with the flow of the nervous system. It has to be corrected. It must be fixed. But when there needs to be support beyond that, that's where our soft wave tissue regenerative therapy comes in. Now, soft wave isn't just for pain. It gets a lot of credit for helping people with pain, and it's amazing. What it does is it stimulates mesenchymal stem cells, it improves blood flow, and it reduces neuroinflammation at the cellular level. So here's what this means. For Tourette's patients, especially those with injury histories or chronic inflammation, we use soft wave on the neck, the suboccipital region, which is the base of the skull, the thoracic spine, even the jaw and the face. This improves tissue pliability and it improves brain to body communication. Most importantly, this improves the patient's resilience. Because as the tissues function better and they're more pliable and less rigid, there's a lot more resilience when that happens. We also run functional labs that most providers ignore. So if you go to a provider in the medical model, they're going to do diagnostic lab work. Very helpful, just not necessarily in this situation. So we do functional labs that are needed, and that's the beauty. It can be remote. We can send you the kits. You don't have to be in the office for these. But our panels include a GI map stool analysis, organic acids, omega-3 to 6 ratio, neurotransmitter precursors, vitamin and mineral sufficiency. When we find, for instance, low magnesium, high quinolinic acid, or glutamate excess, we can tailor supplementation to support GABA modulation, that's a neurotransmitter, dopamine stabilization, gut-brain axis health. Some of our most used formulas are, there's a product we use, Adrenol, that calms the stress response. Sometimes we use reacted magnesium for tic reduction. There's another product called SBI Protect for gut inflammation, Balance D for dopamine and mood balance. But here's the deal. This is personalized care. It's not guesswork. So even of those 4 formulas we just mentioned, some people need those, some people don't, some people need one over the other. It doesn't make sense to just try things. You may guess, you might get it right. But if you aim at nothing, you'll hit it every time. There's got to be specificity. And that is one of the most powerful things I can share with you right now, is that that specificity is what matters. If you're just tuning in, this is your weekly checkup. I'm Dr. Lazar. Our number is 866-521-WELL, 866-521-9355. We're talking about Tourette syndrome, and we'd love to offer you a complimentary consultation as our thank you for being a loyal WMUZ listener. If you're listening on the radio, thank you for that. If you're streaming online, thank you for that. And if this is online, please like and subscribe so other people around the world can hear this message. The $224 consultation, we waive that. If you come into the office for that, we also include a 15-point posture IQ check, which is part of the Lazar method. We also, if you're remote, we're happy to do the consultation virtually with you as well. And that's how we can help people. We have intensive programs where people can come in from wherever they are, from all over the world. We've had people in from Italy, Saudi Arabia, Canada. I don't know. I'm sure there are other places. Norway. I'm sure there are other places. And the reason I say that is because the work works. The work works. And people are willing to do whatever it takes to get results, as are we. And we stop at nothing to make sure that you get the results you deserve. Again, it's personalized care. It's not guesswork. We're going to take a short break. We'll be back to answer your questions right after this. Hey, welcome back to your weekly checkup. I'm Dr. Lazar, taking your calls at 866-521-WELL, 866-521-9355. We're talking about Tourette syndrome and how the upper cervical work we do with the Lazar method can dramatically help people with this. Now, there is a healing journey, and I want to walk you through that step by step. I want to walk you through what it looks like to work with our team. So here's the 7-step plan that we take patients through. Now, smart people say you should have 3 steps and that sort of thing. If 3 steps would do it, we do it in 3 steps. But these are the 7 we have to take people through, and we get really amazing results, or we see great results. You actually get the results. Number 1, we do a comprehensive intake. We listen deeply. We learn your story, your history, your symptoms, your fears, your goals. That intake is one of the most important things that sets the Lazar method apart. Then we do digital motion x-rays and thermography. We don't guess. We image in motion, not with you just still, because we want to see how your spine behaves under stress. The stress of gravity. So you're not lying down, you're sitting or standing. And some of the views will have you move because we want to see what happens to your spine, how it behaves under stress. The 3rd step is we do nerve scans. We also do posture IQ. So we measure brain to body communication and proprioceptive imbalances in real time. Because your nervous system controls the involuntary postural muscles, we're checking nerve function and its effect on posture. It tells us a tremendous amount of information. The procedure we use for the upper cervical corrections is QSM3. That stands for quantum spinal mechanics. We use advanced, precise, gentle techniques that reduce the mechanical and neurological stress on your brainstem. Massive results. And here's the crazy thing. It feels like you're having your pulse taken. It's actually extremely gentle. We're not forcing anything. We're not popping, cracking, twisting, pushing. It's an unlocking procedure on your spine, which is really cool. The 5th thing we do, soft wave TRT, tissue regenerative technology therapy. That reduces inflammation, enhances healing, rebuilds neurological and soft tissue resilience. That part is really cool. The 6th thing we do targeted supplements and labs. These are precision-based protocols. They're not cookie cutter multivitamins. They're not stuff you can buy in the store. It's healthcare quality. It's based on your body chemistry. The 7th thing is we monitor progress and help with life integration. Because this isn't just about symptom relief, this is about transforming lives. And so our programs are comprehensive. The Lazar method is extremely effective at that. And if you're listening, wondering if you're a candidate, wondering if this is the right fit for you, there's one way to find out. Our number is 866-521-WELL, 866-521-9355. We've built a system that works, and if you're ready to start your journey, our team is ready for you. Now, we can't help everyone, but we certainly promise that if we can help, we'll tell you. If we can't help, we'll help you find somebody who can. I'm Dr. Lazar. We're going to take a short break. We'll be back talking about Tourette syndrome right after this. Welcome back to your weekly checkup. I'm Dr. Lazar. Let me close with this. A mom once asked me, "Do you really think my son can have a normal life? He was struggling with really, really severe Tourette's." I said, "No, I don't. I think he can have an extraordinary life." And that's what I believe for every single one of you right now. Tourette syndrome may be part of your story, but it's not the end of it. If this episode spoke to you, go to lazarspinalcare.com. It's Lazar, spinalcare.com, and request your new patient appointment. Or call our office and ask for the Tourette Syndrome Recovery Plan. If you're just joining us, you're in luck. We're going to replay this show on Tourette Syndrome from the top so you can hear exactly what's working for our patients and how you or your child can get started on the path to healing. Stick around. You're not going to want to miss this. Quick reminder, if you hear anything that resonates with you, visit lazarspinalcare.com, Lazar, spinalcare.com, and request a consultation, or call us now, 866-521-WELL, 866-521-9355. The sooner you act, the sooner we can help. This is Dr. Lazar. This has been your weekly checkup, reminding you that your nervous system is brilliant, your body is not broken, and healing is possible. Thanks so much for tuning in. God bless you.